Chapter 18, Points, continued. All the points listed in this chapter are fairly commonly used clinically, yet they have not been introduced in points 1, 2, 3 in chapters 3 to chapter 5. Altogether, there are 63 points, which include 36 points from differentiation and treatment in clinic, and 27 points from essentials of level test for international acupuncture doctors. To facilitate introduction and study, we sum up the points into the following groups. Points of the head and neck region, totaling 15 points. Points of the chest and abdomen region, 15 points. Points of the back, 10 points. Points of the upper extremities, 10 points. And points of the lower extremities, 13 points. Points of the head and neck. Location on the head, directly above the pupil, 0.5 tun above the anterior hairline, at the midpoint of the line connecting Shen Ting and Tou Wei. Indications: headache, dizziness, pain in the outer canthus, windstroke, coma, and epilepsy. Methods: puncture 0.2 to 0.3 tun or prick with 3-edged needle to cause bleeding. Moxibustion, 3 to 5 cones or 5 to 10 minutes. Su Liao, location, on the face, at the center of the nose apex. Indication: nasal obstruction, epistaxis, rhinorrhea, rosacea, convulsions, coma. Methods: puncture 0.3 to 0.5 tun upward, or prick to cause bleeding. Location, on the face, directly below the outer canthus, in the depression below the zygomatic bone. Indication: facial paralysis, twitching of the eyelid, pain under the eyes, and toothache. Methods: puncture 0.2 to 0.3 tun, or puncture horizontally, 0.5 to 1 tun. Location, on the forehead, directly above the pupil, in the eyebrow. Indications: redness, swelling and pain in the eye, pain in the frontal area, facial paralysis, ptosis of the eyelid, myopia in teenagers. Methods: puncture 0.1 to 0.2 tun. Puncture along the skin through the Chuan Zhu or Si Zhu Kong. Shang Ying Xiang, location, on the face, at the junction of the alar cartilage of the nose and nasal concha, near the upper end of the nasolabial groove. Indication: headache, common cold, and nasal obstruction. Methods: puncture 0.3 to 0.5 tun, obliquely upward. Jia Changjiang, location, in the mandible region, 1 tun lateral to the Changjiang, on the mandible. Indications: facial swelling and pain, facial paralysis or spasms, trigeminal neuralgia. Methods: puncture 0.2 to 0.5 tun, no Moxibustion. Jian. Location: above the apex of the ear auricle, at the tip of the auricle when the ear is folded forward. Indication: redness, swelling and pain of the eyes, frontal and one-sided headaches, nebula, sore and congested throat, Cordellum, high fever. Methods: puncture 1 tun or prick to cause bleeding, 3 to 5 drops. Moxibustion, 3 to 5 cones or 5 to 10 minutes. Jiaosun. Location: on the head, above the ear apex, within the hairline. Indications: ear pain, toothache, redness, swelling and pain of the eyes, pain and stiffness of the neck, hepatitis, retinal bleeding, head and neck rigidity, swelling and pain of the gingiva. Methods: puncture 0.1 to 0.2 tun, horizontal puncture 0.3 to 0.5 tun, moxibustion 3 to 5 cones or 5 to 10 minutes. Location: on the head, directly above the ear apex, 1.5 tun above the hairline, directly above the jiaosun. Indication: headache, dizziness and vertigo, vomiting, eye disease, infantile convulsions. Methods: puncture 0.2 to 0.3 tun, puncture horizontally 0.5 to 1 tun, moxibustion 3 to 5 cones or 5 to 10 minutes. Location: on the lateral side of the head, on the posterior margin of the temple, anterior to the anterior border of the root of the ear auricle, and posterior to the superficial temporal artery. Indication: headache, swelling and pain in the cheek, tinnitus, facial paralysis. Method: puncture 0.3 to 0.5 tun or puncture obliquely 0.5 to 1 tun. Moxibustion 3 to 5 cones or 5 to 10 minutes. Xuan Lu. Location: on the head, in the hair above the temple, at the midpoint of the curved line connecting Tou Wei and Qu Bin. Indications: headache, migraine, toothache, fever, anhidrosis, pain in the outer canthus, neurosis. Methods: puncture 0.2 to 0.5 tun, moxibustion 2 to 5 cones for 5 to 10 minutes. Houding. Location: on the head, 5.5 tun directly above the midpoint of the posterior hairline and 3 tun above the Nao Hu. Indication: headache, migraine, dizziness and vertigo, epilepsy, insomnia, pain and stiffness of the neck, and psychosis. Methods: puncture horizontally 0.5 to 0.8 tun, moxibustion 3 to 5 cones or 5 to 10 minutes. Yamen. Location: on the nape of the neck, 0.5 tun directly above the midpoint of the posterior hairline, below the first cervical vertebra. Indications: headache, pain and stiffness of the neck, epilepsy, aphasia, the stiffness of the tongue, numbness, hysteria, brain paralysis, schizophrenia. Methods: puncture 0.3 to 0.5 tun. Yiming. Location: on the nape of the neck, 1 tun posterior to the Yi Feng. Indication: headache, dizziness and vertigo, tinnitus, insomnia, psychosis, optic atrophy, early stages of cataracts, myopia in teenagers. Methods: puncture 0.5 to 1 tun. Sanmian. Location on the neck at the midpoint of the line connecting Yi Feng and Feng Shi. Indication: insomnia, dizziness and vertigo, hypertension, hysteria, and psychosis. Method: puncture 0.5 to 1 cun. Points of the chest and abdomen. Xuanji. Location on the chest and on the anterior midline, 1 cun below 10 tu. Indications: distension and pain in the chest and hypochondriac region, hiccups, asthma, sore throat. Method: puncture 0.2 to 0.3 cun, Moxibustion 3 to 5 cones or 5 to 10 minutes. Shufu. Location on the chest, below the lower border of the clavicle, 2 cun lateral to the anterior midline. Indications: cough, pain in the chest, asthma, pleurisy, intercostal neuralgia, and bronchitis. Method: puncture 0.2 to 0.4 cun, Moxibustion 3 to 5 cones or 5 to 10 minutes. Tianchi. Location on the chest, in the 4th intercostal space, 1 cun lateral to the nipple and 5 cun lateral to the anterior midline. Indications: fullness of the chest, irritability, cough, asthma, pain in the chest, mastitis, lactation insufficiency. Method: puncture 0.2 to 0.3 cun, Moxibustion 3 to 5 cones or 10 to 20 minutes. Jiquan. Location on the apex of the axillary fossa, where the pulsation of the axillary artery is palpable. Indications: cardialgia, pain and fullness of the chest, palpitations, shortness of breath, pain and fullness in the hypochondriac region, pain and cold in the arm and elbow. Methods: puncture 0.2 to 0.3 cun, Moxibustion 5 to 10 minutes. Da Bao. Location on the lateral side of the chest and the middle axillary line in the 6th intercostal space. Indications: pain in the chest and hypochondriac region, asthma, general body ache, coldness and pain in the upper and lower extremities. Methods: puncture 0.2 to 0.3 cun, Moxibustion 3 to 5 cones or 10 to 20 minutes. Jianli. Location on the upper abdomen and on the anterior midline, 3 cun above the center of the umbilicus. Indications: abdominal pain and distension, epigastric pain, vomiting, anorexia. Methods: puncture 0.5 cun to 1 cun, Moxibustion 5 to 10 cones or 10 to 20 minutes. Xiaowan. Location on the upper abdomen and on the anterior midline, 2 cun above the center of the umbilicus. Indications: abdominal pain and distension, diarrhea, vomiting, anorexia, and epigastric pain. Methods: puncture 0.5 to 1 cun, Moxibustion 5 to 10 cones or 10 to 20 minutes. 体位. Location: on the upper abdomen, 4 tun above the center of the umbilicus, 4 tun lateral to the anterior midline. Indications: gastroptosis and dyspepsia. Methods: puncture 3 to 4 tun. Puncture subcutaneously or under the external oblique muscle of the abdomen towards tianshu. After inserting the needle obliquely, lift and at the same time rotate the needle. Moxibustion 3 to 5 cones or 10 to 30 minutes. Wei Shang. Location: on the upper abdomen, 2 tun above the center of the umbilicus, 4 tun lateral to the anterior midline. Indications: gastroptosis, stomachache, abdominal distension. Methods: puncture obliquely and subcutaneously, 0.2 to 0.3 tun towards tianshu or shen xue. Gu. Location: on the lower abdomen and on the anterior midline, at the midpoint of the upper pubic symphysis. Indications: lower abdominal pain and distension, dribbling urination with difficulty, nocturnal enuresis, impotence, seminal emission, scrotal eczema, dysmenorrhea, abnormal menstruation. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Da He. Location: on the lower abdomen, 4 tun below the center of the umbilicus and 0.5 tun lateral to the anterior midline. Indications: pain in the lower abdomen, seminal emission, pain in the external genitalia, abnormal menstruation, dysmenorrhea, leukorrhea. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 5 to 10 minutes. Shui Dao. Location: on the lower abdomen, 3 tun below the center of the umbilicus and 2 tun lateral to the anterior midline. Indication: distension and pain in the lower abdomen, dysmenorrhea, dysuria, cystitis, ascites. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Fu Jie. Location: on the lower abdomen, 1.3 tun below Da Heng and 4 tun lateral to the anterior midline. Indications: pain around the umbilicus, loose stools with undigested food, pain in the hypochondriac region. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Dai Mai. Location: on the lateral side of the abdomen, at the crossing points of a vertical line through the free end of the 11th rib and a horizontal line through the umbilicus. Indications: abnormal menstruation, hernia, pain in the lumbar and hypochondriac region, leukorrhea with white and yellow discharge, adnexus, pelvic infection. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Zigong. Location: on the lower abdomen, 4 cun below the center of the umbilicus, and 3 cun lateral to 中极. Indications: prolapse of the uterus, abnormal menstruation, dysmenorrhea, infertility, adnexitis, cystitis, orchitis, pelvic infection. Methods: puncture, 0.3 to 1 cun, moxibustion, 3 to 5 cones or 10 to 30 minutes. Points of the back. Location: on the back and on the posterior midline, in the depression below the spinous process of the first thoracic vertebra. Indications: pain and stiffness of the head and neck, chills and fever, malaria, anhidrosis, cough, asthma, amenorrhea, and scrofula. Methods: puncture 0.5 to 1 cun, moxibustion 3 to 5 cones or 10 to 30 minutes. Shenju. Location: on the back, on the posterior midline, in the depression below the spinous process of the third thoracic vertebra. Indications: pain in the chest and back, cough, asthma, infantile convulsions, fever, delirium, B syndrome, and neurosis. Methods: puncture 0.3 to 0.5 cun, moxibustion 3 to 5 cones or 10 to 30 minutes. Ling Tai. Location: on the back and on the posterior midline, in the depression below the spinous process of the sixth thoracic vertebra. Indications: cough, asthma, stiffness of the back, pain in the back, body fever, furuncle. Methods: puncture 0.3 to 0.5 cun, moxibustion 3 to 5 cones or 10 to 30 minutes. Jianjing. Location: on the shoulder, directly above the nipple, at the line connecting dazhui and the abdomen. Indications: pain in the shoulder, back and arm, pain and stiffness of the head and neck, carbuncle, furuncle, mastitis, functional uterine bleeding, dystocia, poliomyelitis. Methods: puncture 0.3 to 0.5 cun, moxibustion 3 to 5 cones or 10 to 30 minutes. Qu Yuan. Location: on the scapula, at the middle end of the suprascapular fossa, at the midpoint of the line connecting Naofu and the spinous process of the second thoracic vertebra. Indications: pain in the shoulder and back, stiffness of the shoulder and arm, pain and numbness in the whole body. Methods: puncture 0.3 to 0.5 cun, moxibustion 3 to 5 cones or 10 to 30 minutes. Jianzhen. Location: posterior and interior to the shoulder joint, 1 cun above the posterior and the end of the axillary fold when the arm is adducted. Indications: pain in the scapular region, pain and motor impairment of the arm, pain in the supraclavicle fossa, deafness, tinnitus. Methods: puncture 0.5 to 1 cun, Moxibustion, 2 to 3 cones for 15 to 20 minutes. Sanjiao Shu. Location on the lower back, below the spinous process of the first lumbar vertebra. 1.5 tun, lateral to the posterior midline. Indications: abdominal distension, diarrhea, anorexia, lumbago, gastritis, enteritis, nephritis. Methods: Pangguang Shu. Location on the sacrum, on the level of the second posterior sacral foramen. 1.5 tun, lateral to the midline. Indication: pain in the lumbar and sacral region, swelling, itching, and pain in the external genitalia, sciatic neuralgia, disorder in the urinary and reproductive systems. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Bai Huan Shu. Location on the sacrum and on the level of the fourth posterior sacral foramen. 1.5 tun, lateral to the midline of the sacrum. Indication: pain in the lumbar and leg region, seminal emission, leukorrhea, irregular menstruation, uterine hemorrhage. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones for 10 to 30 minutes. Shi Zhui. Location on the lower back of the posterior midline, below the spinous process of the fifth lumbar vertebra. Indications: lumbar and sacral pain, pain in the lower extremities, dysmenorrhea, irregular menstruation. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Points of the upper extremities. Bi Nao. Location on the lateral side of the arm, at the insertion of the deltoid muscle, and on the line connecting Qu Chi and Jian Yu, 7 tun above Qu Chi. Indications: fever and aversion to cold, athetosis of the neck, redness and swelling of shoulder pain, scrofula. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones for 10 to 30 minutes. Tianjing. Location on the lateral side of the upper arm, in the depression 1 tun proximal to the tip of the olecranon when the elbow is flexed. Indication: pain of the elbow and arm, hemicrania, stiff neck, swelling, and pain of the outer canthus, deafness, tinnitus, scrofula. Methods: puncture 0.3 to 0.5 tun, moxibustion 3 to 5 cones for 10 to 30 minutes. Shou San Li. Location on the radial side of the dorsal surface of the forearm and on the line connecting Yangxi and Qu Chi, 2 tun below the cubital crease. Indications: contracture and motor impairment of the elbow, pain of the shoulder and back, numbness of the upper extremities, facial paralysis, common cold, stomachache, abdominal pain. Methods: puncture 0.5 to 1 tun, moxibustion 3 to 5 cones or 10 to 30 minutes. Si Du. Location on the dorsal side of the forearm and on the line connecting Yang Shi at the tip of the olecranon, 5 tun distal to the tip of the olecranon between radius and the ulna. Indications: pain in the elbow and forearm, deafness, tinnitus, toothache, headache. Method, puncture 0.5 to 1 tun, moxibustion 3 to 5 cones, or 10 to 30 minutes. R by location, 2 points on the palmar side of each forearm, 4 tun proximal to the carpal crease on each side of the tendon of the radial flexor muscle of the wrist. Indications, forearm, neuralgia, pain in the chest, hypochondriac region, hemorrhoid, prolapse of anus. Methods, puncture 0.5 to 1 tun. Yin Si, on the palmar side of the forearm and on the radial side of the tendon of the ulnar flexor muscle of the wrist. 0.5 tun proximal to the crease of the wrist. Indication, cardiac pain, palpitation, susceptibility to fear, epigastric pain, sudden hoarseness, afternoon fever. Method, puncture 0.5 to 1 tun, moxibustion 3 to 5 cones, or 10 to 20 minutes. Lao Gong, location, at the center of the palm, between the second and third metacarpal bones, but closer to the latter, in the place that can be touched by the tip of the middle finger when a fist is made. Indications, windstroke, heat stroke, cardiac pain, pain in the chest and hypochondriac region, epilepsy, tinea of the palm, susceptibility to giggle. Methods, puncture 0.2 to 0.3 tun, moxibustion 2 to 3 cones, or 5 to 10 minutes. Sanjian, location, in the depression of the radial side, proximal to the second metacarpal phalangeal joint when a loose fist is made. Indications, pain of the eyes, toothaches, sore throats, hyperigmus, diarrhea. Methods, puncture 0.2 to 0.3 tun, moxibustion 2 to 3 cones, or 5 to 10 minutes. Xie, location, 4 points on the dorsum of each hand, at the junction of the red and white skin, proximal to the margin of the webs between each two of the 5 fingers of the hand. Indications, swelling and pain in the back of the hand, numbness of the fingers, stiffness and pain of the head and neck, sore throat, toothaches, pain in the eyes, fever. Methods, puncture 0.3 to 0.5 tun, or prick with a 3-edged needle to cause bleeding. Moxibustion 3 to 5 minutes. Guanchong, location, on the ulnar side of distal segment of the 4th finger. 0.1 tun from the corner of the nail. Indication, headache, sore throat, parotitis, thirst, fever, febrile disease. Methods, puncture 0.1 tun or prick with a 3-edged needle to cause bleeding. 解析 Location in the central depression of the crease between the instep of the foot and the leg, between the tendons of the long extensor muscles of the great toe and the long extensor muscle of the toes. Indication: edema of the head and face, abdominal distension, constipation, headache, dizziness, muscular atrophy, motor impairment, pain and paralysis of the lower extremities, swelling and pain in the ankle. Methods: puncture 0.3 to 0.5 twin, moxibustion 3 to 5 cones or 10 to 20 minutes. 束骨 location on the lateral side of the foot, posterior to the fifth metatarsal phalangeal joint, at the junction of the red and white skin. Indications: stiffness and pain in the neck, headaches, dizziness, pain in the lumbar area and the back of the leg. Methods: puncture 0.2 to 0.3 twin, moxibustion 3 to 5 cones or 10 to 20 minutes. 商丘 location in the depression anterior and inferior to the medial malleus, at the midpoint of the line connecting the tuberosity of the navicular bone and the tip of the medial malleus. Indications: abdominal distension, diarrhea, constipation, stiffness and pain of the tongue, listlessness, epilepsy, dream-disturbed sleep, hemorrhoid. Methods: puncture 0.3 to 0.5 twin, moxibustion 3 to 5 cones or 10 to 30 minutes. 大中 location on the medial side of the foot, posterior and inferior to the medial malleus, and in the depression medial and anterior to the attachment of the Achilles tendon. Indications: stiffness and pain of the lumbar area, swelling and pain in the sole, dysuria, constipation, irregular menstruation. Methods: puncture 0.2 to 0.3 twin, moxibustion 3 to 5 cones or 5 to 10 minutes. 水泉 location on the medial side of the foot, posterior and inferior to the medial malleus, 1 twin directly below 太溪, in the depression on the medial side of the tuberosity of the calcaneum. Indications: irregular menstruation, dysmenorrhea, amenorrhea, dysuria, abdominal pain. Methods: puncture 0.2 to 0.5 twin, moxibustion 3 to 5 cones or 5 to 10 minutes. 里内庭 location under the sole, between the second and third toe, opposite to 内庭. Indications: pain in the toes, infantile convulsions, epilepsy, acute stomachache. Methods: puncture 0.2 to 0.5 twin, moxibustion 3 to 5 cones.
一路漫漫，披荆相伴，